A common emergency we see here with dogs and cats is when they're in respiratory distress. If you think that your dog is in respiratory distress, some things that you can look for at home are if they are breathing irregularly, meaning that they're breathing either really fast or there is a lot of effort you see. Usually in the abdomen area is when you can notice these effortful breaths. Things like a distress, kind of uncomfortable attitude, so they're trying to lie down, they can't get comfortable, standing up, pacing around, that kind of thing. You can also look at the color of their gums. So if you lift up their lip and look at their gums, if they look kind of pale pink or even white, then that is something to be concerned about. If you have a cat in respiratory distress, things to look for at home look like open mouth breathing. So with cats, they normally breathe through their nose. So if they are open mouth breathing, it's usually a sign of stress or having difficulty breathing. So that is a big indicator if they're having troubles there. They can also be very restless, so trying to lie down, walk around, pacing, uncomfortable. Sometimes they'll even vocalize, so if they're meowing, it sounds weird, you don't know why they're meowing, things like that. If you think your cat or dog are in respiratory distress, you should call the emergency hospital right away. Tell them how long you're going to be so that the medical team can be prepared. This is a true emergency, and when your cat or dog are struggling to breathe, you want to bring them to the emergency right away. Things to expect when you bring your dog or cat to the emergency hospital if they're in respiratory distress is the reception will call the medical team right away. So this would be a technician who will come out, assess your dog or cat, ask you a few questions, and then bring them into the treatment room right away. That includes them doing their exam on either your cat or dog, potentially giving them oxygen if they're truly in respiratory distress. The veterinarian will take a look at them, and then they will talk to you, the owner, about any next steps at that point.